Hey everybody, welcome back to The Health Guy. I'm your host, Bobby Kwasny, and I'm honored to be here with the one and only Dr. Porter Brown from Brown Chiropractic and Rehab. How you doing today, Dr. Brown?
I'm doing well, welcome.
All right, first let's start the show off by just give us the broad strokes of what it is to be the one and only Dr. Porter Brown. Where'd you come from? Where'd you go to school? Give us a little history.
So born and raised in Thunder Bay. Then I went to school out in Edmonton, did my undergrad in kinesiology out there, and then decided that I want to be in school forever. So I went down to Chiropractic College in Toronto and did another 4 years there and got my doctorate of chiropractic.
Super cool, super cool. Tell us a little bit about chiropractic. Chiropractic treatments, chiropractic therapy.
So chiropractic, I mean, probably if you asked anyone, they would probably tell you something along the lines of some back pain, spine pain, and primarily, you know, the main way they would be treated is with adjustments. Now, for the most part, they're pretty accurate, right? But I mean, there's so much more to it as well. It's not all just, you know, cracking or manipulations, what we call it, or cavitations.
Right.
It could be also, you know, many other things as well.
Gotcha. I noticed, I mean, I've been fortunate enough to be seeing you for treatments for about a year now. The thing that drew me to you was your soft tissue work, FRR, ART. Super cool sounding acronyms. What do they stand for? What do they do? And what are they effective to treat?
Well, they all kind of fall under the broad title of soft tissue therapies. So they're each just individual techniques, but ART, active release technique, FR, functional range release. Again, they're just different ones underneath it. But specifically, yeah, that's what I'm trained in and what I offer. But again, chiropractic, I mean, can offer more than just soft tissue. It can also, you know, be adjustments, mobilizations, rehab and exercise, right? And then even acupuncture. Some practitioners are trained in that. So it's a little bit, you know, it's more than just the traditional manipulations and cracking, if you want to sound, right?
Right, super cool. So what's the primary difference? One thing I noticed from your adjustments right away, I've been seeing and getting chiropractic treatment. I've lived all over Canada and the US, a variety of different therapists, and your stuff is very, very different. It's very precise. What is different with the educational process for chiropractors coming out of school today as opposed to 15, 20, 25 years ago?
I could speak to that, I think, but again, I only know what I've done, and then a lot of different schools out there will offer different things, but I know at least where I went with CMCC, they have a heavy focus on evidence-informed chiropractic care, right? So meaning you got some literature, you got some research studies to back you up in what you're doing with your patients. So that's definitely one difference I think has kind of evolved, and granted, the research just wasn't there in the past with many previous chiropractors. So I know that has probably been a shift over the years, and again, all those other types of treatments, they are now offered, and we're trained in that at school. It's a little bit more than just the manipulations now.
Super cool. Thanks for tuning to The Health Guy, everybody. Wherever you are, maybe watching, however you may be tuning in, thanks for watching. See you next time on Shaw TV.